Good evening, ladies and gentlemen, and welcome to Chief Joseph Middle School and to the Tri-Cities, and to KADLEC Regional Medical Center is proud to present tonight's performance. Over the past 3 or 4 years, on behalf of KADLEC, my name is Jim Hall, and over the past several years, we have felt it important at least 2 or 3 times a year as an organization to bring different health-related experts to talk to members of our community. And one of the first people when we started doing this that we had brought to the Tri-Cities was Dr. Hans Diehl, the speaker that you were here tonight to be hearing. And I think when he came initially, it gave us an idea. We need to do more of these kinds of things as a community, to provide these opportunities for residents of our community to come out and learn various health information that is being shared throughout not only the United States, but throughout the entire world. So I think Dr. Diehl and the CHIP program and what started here about 4 or 5 years ago has really motivated KADLEC as an organization to put on events like this throughout the course of the year. And it really is neat to see people that come out and are interested in improving their health and maintaining their health to an event like tonight. So thank you so much for coming. Before I introduce Dr. Eric Shadle, who will introduce our featured speaker tonight, I do want to share with you that tonight's program is being recorded for future airing on television by Charter Cable Channel 3. Lloyd Swain and his staff is videotaping this event tonight, and they are on Channel 3 on the cable system. And Lloyd tells me that probably by the weekend, if not by the weekend, early next week, if you look on Channel 3, they'll have some graphic listings as to when this program will re-air, and they will be re-airing it a number of times. And in addition, the program is also put on YouTube, so you can share with your family members who may be in another part of the country if you want them to see this, that probably in the next few days, this program will be up on YouTube as well. So the reach not only extends to you out in our audience tonight, but throughout the Tri-Cities and actually even throughout the rest of the country and the world over the internet. So we're thankful for Lloyd and his staff for being here to provide that service as well. So without further ado, I'd like to bring to the podium Dr. Eric Shadle, who is a facilitator of the CHIP program here in the Tri-Cities, and along with KADLEC Regional Medical Center and Washington State University have been instrumental in bringing the CHIP program to the Tri-Cities. Please welcome Dr. Eric Shadle.
Well, I'd like to welcome each of you to the program tonight, and I'm excited that Dr. Hans Diehl could be here. I've known him for 11 years, and when he came to Rockford, Illinois, where I was practicing as an obstetrician gynecologist, and I went to his program, my wife and I embraced the program for our personal lives, and it ended up changing my professional life as well. And what happened is that my medical practice changed with an emphasis more towards preventive medicine. And when I transferred out here, I retired from medicine and was happy to be able to find a medical center in KADLEC that is forward-thinking and interested in the community's health and not just the medical care. And you know, tonight it's a very timely topic, as no matter what your politics are, we are certainly in a health care debate, aren't we? And last night, of course, we had the president talking about health care and the need to make some changes. And tonight we want to add to that discussion in what is health care, and how can we, as the lecture title says, move from pills to peas. And so because of the timely nature of this discussion, there's no one better than Dr. Hans Diehl to present this. So I want to introduce him as a world-renowned author, lecturer. He has added to the healthcare debate and to our concepts really worldwide of how to take control of our own health. And so I want to welcome Dr. Diehl as a friend and a colleague and certainly a health authority to the stage tonight. Thank you very much.
Good evening. It certainly is good to be here in the Tri-Cities and to help to empower people to recognize that you can do more for yourself than all the medical professionals and all the series of interventions that you can have. All of these are only helping you when it comes to chronic disease to give you the opportunity to combine with the medical resources and together to make a difference in your health level. I remember waiting for one of my colleagues at the medical school. I had an appointment with him and he was late again. And so I was somewhat frustrated as I sat in the waiting room, but then I thought I might as well make the best of these difficult moments. And I thought maybe this is a good time to hear what patients are saying about hospitals and doctors and so on. So I'm more of an educator than a physician, and so I didn't have a white coat on. I wanted to discuss some research concepts with my colleague. And so I settled into the waiting room, and there were 3 men waiting for him to be taken care of. And they began to talk, and I listened very intently, and a 50-year-old man said, you know, I haven't had any problems for a long time, but lately I seem to wake up every morning at 6 o'clock. When I wake up in the morning at 6 o'clock, I have this pressure in my abdominal area, and I find myself moving to the bathroom, and there I empty my bladder. I haven't had problems in the past, but it seems to be kind of a pressure system there. And I thought to myself, he is probably a man that has a common Western disease called, what do you think? Prostate problems. And he would probably end up with the urologist. And then the next person, somewhat older, probably 58, 60 years of age, piped up and he said, you know, I know what you mean. I happen to wake up at 7 o'clock every morning pretty regularly, and I find the same kind of a pressure, and I move towards the bathroom, and then I sit, and I sit, and I said it's even more difficult now than years ago in being productive. And I thought to myself, oh my, here's a common Western disease called constipation. Nobody talks about it. Everybody has it. And I thought, he would probably get a prescription for some laxative, and he will pay for the medication, and he will take his laxative, and that will probably take care of things. And then there was this older man there, probably in his 80s, and he was rather a little bit show-off. And he said, I don't understand all your problems. He said, every morning at 6 o'clock, I empty my bladder. I have no problem. He said, every morning at 7 o'clock, I have a large bowel movement. I don't have any problems there. He said, my problem is I don't wake up until 8 o'clock. And that's what happened all too often in our society. We find ourselves waking up too late. We find ourselves in a mess. And we look for someone to clean us up. And we begin to realize that we have a large responsibility of trying to avoid these kind of problems. And so I want to take you tonight through a little journey of where we are and perhaps what we can do to help ourselves. We all recognize, as the President also clearly identified, that we have an unusual high rate of chronic diseases that we didn't have 100 years ago. As a matter of fact, today, every second person in the Tri-Cities here can expect to die from cardiovascular disease, that's heart disease and strokes.